7 symptoms of heart attack, 1 month before. In 2024, the Centers for Disease Control and Prevention confirms that in the United States, someone has a heart attack every 40 seconds. Additionally, about 805,000 Americans experience a heart attack each year, with 605,000 being their first and 200,000 being recurrent events. Most people believe it strikes without warning, but the truth is different. Long before the crisis arrives, the body often whispers subtle signals, small changes that can appear weeks in advance. The tragedy is that almost no one recognizes them until it is too late. In this video, I want to walk with you through 7 silent symptoms that may show up a month before a heart attack. Everything I share here is grounded in science, backed by trusted research, and you will find the sources listed clearly below the video so you can check them yourself. And before we begin, don't forget to like this video, subscribe to our channel, and turn on the notification bell so you never miss another message that could protect your health and the health of those you love. Now let's begin with a symptom that many people brush aside, thinking it is just a sign of aging or low energy. Dizziness, lightheadedness. Dizziness and lightheadedness may seem like simple nuisances, but in reality, they are signals that the heart and brain are not receiving enough oxygen. When blood flow is reduced, either because the heart cannot pump strongly enough or because arteries are narrowed, the brain reacts almost immediately with imbalance, blurred vision, or a faint feeling. The cerebellum and brainstem, which control balance and coordination, are especially sensitive to oxygen loss. That is why sudden dizziness can be a red flag for heart disease or even a hidden stroke in progress. Science has made this connection very clear. In 2024, Palangio and colleagues conducted a population study and found that while almost 3/4 of participants could not identify any heart attack warning signs, dizziness and shortness of breath were the most commonly remembered. This shows how frequently the symptom appears, even if people do not fully understand its meaning. Another large study by Chang et al. In 2024 followed more than 24,000 patients who came to emergency rooms in Taiwan with dizziness. Even when these patients were sent home without a diagnosis, their risk of stroke within the first week was almost 6 times higher than the general population, and the danger remained elevated for up to a year. The same study emphasized that every year in the United States, dizziness brings more than 4.4 million people to the emergency room, and between 3 and 5% of those visits are linked to an early stroke. Even more concerning, 35% of strokes tied to dizziness were initially missed by doctors. These findings confirm that dizziness is not just a harmless annoyance, but a major warning sign. So how can you tell when dizziness is harmless and when it requires urgent attention? If you feel lightheaded after standing up too quickly, skipping a meal, or becoming slightly dehydrated, that is usually benign. But dizziness that appears suddenly without explanation, that returns again and again, or that comes with other symptoms like chest discomfort, cold sweat, paleness, or numbness in the arm must never be ignored. In these cases, the body is whispering that the brain or heart is struggling, and immediate medical evaluation is essential. What should you do if dizziness happens? First, sit down right away to avoid falling. Do not try to push through it. Take note of what you were doing when it began, how long it lasted, and whether other symptoms such as chest pain or weakness in the arm appeared at the same time. If the dizziness is sudden, severe, or accompanied by any of these warning signs, call emergency services immediately. If it passes quickly but keeps returning over days or weeks, schedule an appointment with your doctor as soon as possible. Bring a clear description of your episodes so they can evaluate whether it is related to your heart, your blood vessels, or another cause. Dizziness and lightheadedness should never be brushed aside. They are not simply a part of getting older. Listening carefully to that alarm and taking the right steps could protect not only your balance, but your life. Number 2. Numbness and weakness in the limbs on one side of the body. Numbness and weakness on one side of the body are among the clearest warnings that blood flow to the brain has been interrupted. When an artery becomes blocked, oxygen can no longer reach the nerve cells responsible for movement and sensation. Within minutes, these brain cells begin to malfunction or die, and the body reflects that loss. A hand cannot grip, a leg suddenly feels heavy, or one side of the face no longer moves in harmony with the other. It is not the muscles that fail, but the brain struggling to send signals. Scientists have described this process in detail. Nguyen and colleagues in 2024 studied stroke patients in their first weeks of recovery and found that numbness was one of the most common sensory problems. Nearly 97% reported a fixed numbness that did not disappear. 74% described a heavy or dragging limb, and almost half experienced tingling, as if ants were crawling beneath the skin. The study also revealed that symptoms worsened with movement, cold, or damp weather, and could improve with warmth or gentle pressure. These findings remind us that numbness is not a trivial irritation. It affects balance, increases the risk of falls, slows rehabilitation, and even raises the chance of injuries and pressure sores because patients cannot feel warning pain. Karki and Manandar in 2024 confirmed that sudden numbness or weakness on one side of the body is one of the hallmark signs of ischemic stroke, which accounts for 87% of the nearly 795,000 strokes that occur every year in the United States. They emphasized that time is the most critical factor. Brain tissue begins to die within minutes of losing oxygen, and treatment is only effective in the narrow window of a few hours. The authors also highlighted the role of transient ischemic attacks, or TIAs. These mini-strokes may cause numbness or weakness for a few minutes before resolving, but they are never harmless. They are the body's alarm bell that a major stroke may be coming soon. Doctors teach the community to recognize stroke with the FAST method. F for face. Look for one side drooping when smiling. A for arms. Raise both arms and see if one drifts downward. S for speech. Listen for slurred or jumbled words. T for time. Act fast and call emergency services immediately. Remembering fast can save a life because every minute counts. It is also important to distinguish dangerous numbness from ordinary sensations. Many older adults feel tingling in their hands after overwork, or numbness from a pinched nerve in the back. That kind of discomfort is usually slow to build and often improves with rest or position changes. In contrast, numbness or weakness from a stroke comes suddenly, affects only one side of the body, and does not improve when you sit down or stretch. If you notice this type of change, especially if it appears alongside dizziness, chest discomfort, or sudden speech problems, treat it as an emergency. If you or someone close to you experiences sudden numbness or weakness, talk to your doctor immediately. Note the exact time symptoms began, because doctors need this to decide whether powerful treatments like clot-busting medication or mechanical thrombectomy can be given. These therapies work only in the first hours, and the earlier they are started, the more brain tissue can be saved. After the emergency, structured rehabilitation with physical and occupational therapy helps restore independence, but recovery is far harder if treatment is delayed. Numbness and weakness on one side of the body are not just signs of fatigue or age. They are the body's loudest cry for help when the brain is in danger. Number 3. Back pain. Back pain, especially high between the shoulder blades or tucked under the left shoulder, can be the body's early alarm for the heart and the big vessel called the aorta. When a coronary artery tightens or aortic flow is strained, nerves inside the chest can project pain to the upper back. Muscle pain usually eases with stretching or a new position. Cardiac-related back pain tends to linger, ignores posture changes, and may appear out of the blue. Scientists have mapped the deeper story. Added body weight increases the load on the spine and fuels silent inflammation through adipokines like leptin, TNF-alpha, and interleukin-6. Discs and joints wear down faster, nerves are irritated, and pain becomes persistent. That same inflammatory storm also harms blood vessels and the heart, which is why a stubborn upper back ache sometimes walks hand in hand with cardiovascular stress rather than a simple muscle strain. In 2022, Siddiqui and colleagues studied 300 adults with chronic low back pain and found that nearly 3/4 were overweight or obese, and every single point rise in body mass index was linked to an 11% increase in pain severity. They also observed more radiating leg pain, disc degeneration, spinal stenosis, and sacroiliac joint pain in people with excess weight, with women affected more than men. The authors emphasized that weight reduction meaningfully improves outcomes, especially for those with severe obesity. In short, extra weight drives mechanical load and whole body inflammation, and both pathways amplify back pain while also stressing the heart. Modern tools are stepping in as well. In 2023, Mall and Singh reported a deep learning system that outperformed classic machine learning models for detecting coronary artery disease from routine clinical features. This kind of decision support helps clinicians flag cardiac risk earlier, even when a person shows up with vague complaints like back pain that does not behave like a muscle strain. It does not replace a doctor, but it sharpens the early warning. Here is how to use this knowledge in daily life. Treat sudden, unexplained upper back pain as a possible red flag when it does not ease with rest or position changes, when it spreads toward the chest, jaw, or left arm, or when it arrives with cold sweat, paleness, shortness of breath, lightheadedness, or numbness in the left arm. Note the exact time the pain began. Do not drive yourself. If the pain settles but keeps returning over days or weeks, schedule a heart evaluation that may include an electrocardiogram, blood tests for heart strain, and imaging when appropriate. For typical mechanical back pain after long sitting or lifting, start with gentle walking, heat to relax stiff muscles, and posture adjustments. Protect your spine and your heart together by aiming for steady weight loss if needed. Prioritizing daily movement and keeping blood pressure, blood sugar, and cholesterol in healthy ranges. Number 4. Indigestion and bloating. Indigestion and bloating may sound like nothing more than a stomach problem, yet for many older adults, especially women, they can be the heart's early alarm. The heart and stomach are connected through the vagus nerve. And when the heart is deprived of oxygen, this nerve can misfire, creating pressure, burning, or fullness in the upper abdomen. Instead of sharp chest pain, some patients, particularly older women, experience symptoms that mimic reflux or gastritis. This is why so many people reach for antacids when, in truth, their heart is struggling. The tragedy is that these misleading signs often delay a life-saving diagnosis of heart attack. Medical literature has long described indigestion and bloating as atypical warning signs, more common in women and the elderly. Many patients admitted for gastric pain have later been found to be suffering from myocardial infarction. In 2023, Krajewski-Phillips and colleagues examined 438 heart failure patients at emergency departments across the United States. Using unsupervised machine learning, they identified 3 distinct clusters of symptoms. One cluster, seen in 23% of patients, included indigestion, with or without shortness of breath, and this group faced nearly double the risk of acute decompensation and major cardiac events within 30 days. Just as striking, patients without indigestion and without shortness of breath had a much lower risk profile. The authors concluded that indigestion is not a harmless stomach complaint, but a high-risk marker that should guide triage decisions from the very first encounter. So how do you tell ordinary bloating from a cardiac warning? Digestive indigestion usually follows a heavy meal and improves with dietary changes, rest, or simple remedies. Cardiac indigestion often appears suddenly, sometimes even on an empty stomach. It may persist for hours, recur over days, and is often joined by sweating, fatigue, shortness of breath, or discomfort radiating to the jaw, back, or left arm. Antacids do not relieve it, and posture changes bring little comfort. If you or someone you love experiences this kind of unexplained indigestion, treat it as a potential red flag. Seek medical attention promptly, especially if risk factors like high blood pressure, diabetes, high cholesterol, or known heart disease are present. Doctors can run electrocardiograms, enzyme tests, and imaging to detect heart involvement before it escalates. For those already living with heart failure, reporting indigestion early can help clinicians prioritize care and prevent a dangerous collapse. Day to day, protecting both stomach and heart involves smaller, lighter meals, staying active, maintaining a healthy weight, and limiting alcohol. But the most important step is awareness. Indigestion and bloating are easy to dismiss, yet in older adults, particularly women, they may be the body's most deceptive and most important warning. Recognizing that truth and acting quickly can mean the difference between relief and an emergency. Number 5. Jaw pain. Jaw pain is often blamed on teeth, gums, or the jaw joint, but sometimes it is the body's way of pointing to the heart. The connection comes from shared nerve pathways. When the heart muscle is starved of oxygen, pain signals can radiate through the trigeminal nerve into the lower face. Instead of sharp chest pain, a person may feel a deep, dull ache in the left jaw or down toward the ear. This is why some heart attacks, especially in older adults and women, first feel like a dental problem rather than a cardiac emergency. In 2024, Timur and colleagues studied children and adolescents living with rheumatic heart disease and found measurable changes in their jawbones. Using fractal analysis, they showed that chronic heart disease can alter the condyle and gonial regions of the mandible, areas responsible for jaw movement and bite force. These changes suggest that long-standing heart strain does not just affect circulation, but can reshape the skeleton of the jaw, creating discomfort and pain that is easily mistaken for dental trouble. A broader review by May and colleagues in 2023 explained that orofacial pain syndromes often overlap with vascular and nerve disorders. They described how trigeminal nerve dysfunction and conditions such as temporomandibular joint disorder or Eagle syndrome can mimic cardiac pain. In Eagle syndrome, an elongated styloid bone can compress the carotid artery, causing facial pain, but also raising the risk of stroke or even sudden death. The lesson is that jaw pain can have multiple roots: cardiac, skeletal, neural, or vascular, and separating them is essential. So how do you know when jaw pain is a warning sign of the heart? Pain that comes with chewing or known dental issues often improves with treatment from a dentist, but pain that appears suddenly, radiates to one side, or comes with chest pressure, shortness of breath, dizziness, or cold sweat should never be ignored. This is especially true if the ache persists despite rest or has no clear dental trigger. In these situations, the jaw pain may be the disguised voice of the heart calling for urgent help. What should you do? If jaw pain strikes suddenly with other symptoms such as arm numbness, breathlessness, or paleness, talk to your doctor soon. Do not drive yourself. If the pain is recurrent but unclear, ask both your doctor and your dentist for evaluation. Cardiac tests such as an electrocardiogram or blood markers can quickly rule out heart disease, while dental exams can exclude local causes. For those living with chronic heart disease, regular monitoring is vital, because jaw discomfort may signal changes in bone health or circulation that need attention. Jaw pain is not always what it seems. Sometimes it is a tooth, sometimes a nerve, and sometimes the first sign of the heart struggling for oxygen. Number 6. Tired and short of breath. Tiredness and shortness of breath are among the most common signs the heart gives when it is in trouble, yet they are also among the easiest to dismiss. Many older adults blame them on age, lack of sleep, or even a lingering cold. Women, in particular, often experience these symptoms without the classic crushing chest pain. In fact, research shows that nearly 70% of women who suffer a heart attack report fatigue and shortness of breath as their primary symptoms, which are frequently mistaken for flu or stress. This is why so many women arrive at the hospital later than men, missing the best window for treatment. The biology explains why. When the heart cannot pump strongly, muscles and organs are starved of oxygen. The result is a body that feels drained no matter how much rest you get. At the same time, fluid begins to pool in the lungs, making each breath shallow, as if you are climbing a hill without moving. These two signals, fatigue and breathlessness, often appear together, and they rarely stand alone. The American Heart Association's 2022 review, led by Juergens and colleagues, showed that these symptoms commonly cluster with poor sleep, anxiety, or loss of appetite, and their presence is often what guides doctors to escalate treatment or even recommend valve replacement. They are not vague complaints. They are markers of how advanced heart disease has become. The lived experience makes these numbers real. In 2021, McCorney and colleagues studied 64 patients with heart failure and 26 caregivers. Over 81% of patients reported breathlessness, and more than 76% described crushing fatigue. The toll reached far beyond the body. 67% withdrew from social life, 64% changed their diet, and more than half struggled with simple tasks like walking or climbing stairs. Emotionally, 44% reported depression, a third lived with constant anxiety, and another third feared death. Caregivers were pulled in too. Nearly half felt stress, 42% lost patience, 31% described exhaustion, and more than a quarter developed depression themselves. Fatigue and breathlessness, then, are not just medical issues, but shared burdens that reshape the lives of patients and families alike. So how do you tell ordinary tiredness from cardiac fatigue? Normal tiredness fades with a good night's sleep. Cardiac fatigue lingers, returns daily, and may be joined by swelling in the ankles, dizziness, or breathlessness with even small tasks. Breathlessness from exercise is normal. Breathlessness while resting in bed or bending to tie your shoes is not. If these patterns appear, especially if they are new or worsening, they must be treated as warnings from the heart. The best response is action. Speak with a doctor early, even if you are unsure. Simple tests like an electrocardiogram, echocardiogram, or blood markers can reveal whether the heart is behind your fatigue and breathlessness. For those already living with heart failure, monitoring weight, reducing salt, and staying gently active with short walks can improve both breathing and energy. And for families, understanding that these symptoms affect both patient and caregiver opens the door to emotional support and shared coping strategies. Number 7. Cold sweats and paleness. Cold sweats and paleness are not normal sweats from heat or effort. They arrive suddenly, feel clammy and cold, and they do not ease with rest. The science is straightforward. When the heart is starved of oxygen, the body shunts blood away from the skin toward vital organs. Skin loses color and feels cool. At the same time, the sympathetic nerves surge like an alarm, releasing adrenaline that drives the sweat glands into overdrive. Many people also feel the heart race, a fine tremor, or a sinking sensation, and some even near fainting as blood pressure drops. Not every cold sweat is cardiac, and knowing the difference matters. Hyperthyroidism can cause warm sweating with heat intolerance and trembling that builds over time. Anxiety can trigger sweating during stress and often settles once the stress passes. Low blood sugar brings sweating with hunger, shakiness, and confusion that improves after eating. In contrast, heart-related cold sweats and pallor tend to strike out of the blue, often with breathlessness, chest pressure, dizziness, or a gray face that alarms family members. They can appear early, even before classic chest pain, and that is why they are so dangerous when dismissed as flu or nerves. Zantova in 2023 described paleness as a classic sign of reduced circulation and linked sudden sweating, dizziness, and faintness to cardiac causes that demand urgent assessment. Rajabzada, Amira Zodi, and Tagilu in 2025 analyzed heart attack presentations and emphasized that cold sweats, pallor, breathlessness, nausea, dizziness, and profound fatigue commonly clustered during acute coronary syndrome. Their message is simple and serious. These signs are red flags of blocked blood flow and tissue hypoxia, and early recognition protects the window for life-saving treatment. Here is the safest way to respond. If cold sweats and paleness appear suddenly, especially with chest discomfort, shortness of breath, lightheadedness, or a racing heart, treat it as an emergency and call for help immediately. Note the exact time the symptoms began. Do not drive yourself. If the episode settles but returns over the next days, arrange a prompt cardiac evaluation with an electrocardiogram and blood tests to rule out silent heart injury. Day to day, protect yourself by controlling blood pressure, blood sugar, and cholesterol, staying active, and keeping follow-up appointments if you already have heart disease. Above all, trust what your body is telling you. Cold sweats and paleness are the heart's distress signal. Acting quickly can turn a crisis into a close call. Thank you for spending your precious time with us today. Every step you take toward caring for your health is a gift not only for yourself, but also for the people who love you. We wish you strong energy, peaceful sleep, and joyful days ahead. If this message touched you, please show your support with a like. Leave us a comment to share your thoughts, and don't forget to subscribe so you won't miss our upcoming videos. Together, we'll keep walking this journey of health and vitality side by side.